Hello, I'm Martin Wucher, and today we're going to talk about kids that can't fall asleep. This has been a repeated question from our listeners and from our members on our platform, Puzzle of Health. So let's dive in. As you know, this is not medical advice, it's lifestyle support. This is educational stuff that you can use in your family. And if you're really sick and you want medical advice, please go and visit your doctor. I'm not your doctor. I can advise you on lifestyle things that make a huge difference to your health, but I'm not your medical doctor. Okay, I've often seen and heard when you walk into kids, especially teenagers' bedrooms, you have a setup like this here. You can see their mobile phones, you can see their energy saver lights right next to their head. There's a charger, their earphones, everything that a teenager loves. And of course, we think they need that to be prepared for the future world. Let me assure you, nothing is further from the truth. And in our courses, and in our discussions, and in our podcasts, you will learn so much more about light, man-made frequencies, and the good things and the not so good things about them. So let's dive in and see why a child might struggle to fall asleep. Sleeping is a natural process. Most mammals do it. In fact, most animals do it in different forms. And if your child has got any of these symptoms, in other words, it takes half an hour to fall asleep, or a child, especially a little toddler, is really tired, but it can't settle down and it can't relax. It wants a mobile phone or a screen and wants to watch some videos before it can go to sleep. All these things are not a good sign. Another one is if you're actually in the bedroom and you can still see some light. The old story of leaving a light on, especially for kids that are a bit of scared of something, scared of the dark, it's a real issue, but the last thing you want is bright lights. So the bedtime and wake-up times should be routines. They shouldn't be different every day. And another thing that's important is, when did you eat dinner or supper? Try to have a supper that is set at a specific time, that there is a routine in the daily run of the home. And in the end, we want rising times and sleeping times to be more or less settled, especially for younger kids. If they wake up groggy after 8 hours sleep, if they don't look fine, if they're not energetic, there is a problem. If a child is healthy, they often wake up between 5 and 6 in the morning, and once they wake up, it's as if you've started an electric car. It's up and running, and they chat and they do whatever they do, much more so than we adults. Also, we want a fixed wind down routine. In other words, try and make every evening the same. So I've done a whole program and research into sleeping patterns, and these are some of the issues that come up. Number one, the strongest signal that we have to set the brain to sleep is light. So in the morning, we've got sunlight that is orange at sunrise, and then at lunchtime, we've got blue light, and in the evening, we've got sunset with orange light again. In nature, if you would live in nature, that is what your brain would see through the eyes, and the impulses get pushed to your pineal gland, which has the internal clock system. Another signal is when you eat. Animals and mammals aren't made to eat just before they go to sleep. So animals normally, many mammals will wake up, at least the ones that are active during the day. They will wake up, they've got high cortisol levels, which make you energetic and, wide awake, ready for action. You go and search for food, or you go and search for to hunt food. You go along, and eventually when you get your food, you will eat at lunch or in the afternoon or late afternoon. So for humans in a modern environment, good times are, if kids can eat in the morning, they can have some breakfast. We'll talk about how and what is good for breakfast. They can have some lunch. Make sure there's always some protein involved in these meals, and then they have got an early supper. Early supper is great. Your stomach takes about an hour or 2 or 3 sometimes to digest the food. You do not want to have a full stomach, a full tummy, and then go to sleep, because digestion requires energy, so does falling asleep. Both together is a problem. So try and have the digestion done and dusted by the time you put a kid to bed. This is the issue with light. You have here on the left, I've put down dawn just before sunrise. Then we have sunrise. The sun comes above the rises above the horizon, and it's very orange. You can actually sort of look into it until it pops out. What you can do then is you close your eyelids 2 to 3 minutes and you look into the direction of the sun. And then at lunchtime, the light is from above and it is filled with blue light. In other words, the body now knows that it's midday or 12 o'clock. Then the sun will move over, and at sunset, when the sun goes below the horizon, you will see an orange glow, and that means your body now realizes it's dusk, or it's sunset and dusk, and then after it's darkness. Darkness tells the body it's sleeping time, and then we go to the system that runs in your brain. When the system sees orange light, and when it sees orange light in the evening, it will create, through special mechanisms in the brain, it'll make melatonin. Melatonin is considered the hormone of sleep. If you don't have enough, you cannot sleep properly. So if you introduce blue light with a very bright energy saver bulb next to the bed, you tell the brain that it's lunchtime. And the lunchtime light will inhibit, through the eye, through the pineal gland, it'll inhibit melatonin. And therefore, a brain that's been exposed to bright white or blue light in your home is not ready to go to sleep. So let's look at the daily cycle. This is 6 in the morning. You will see the black line here is cortisol. So cortisol rises until 12 o'clock. This is the time that you would hunt, be wide awake, morning, wide awake, wakey in the morning, ready to do the day. And then in the afternoon, your cortisol goes down and you get sleepy and, ready to rest. And then your melatonin goes up. And you see how while the moon's up there, the melatonin's right up there. So these are the phases of crossover. Melatonin goes up, so that makes you sleepy. But if you are excited, if you've eaten stuff that makes cortisol high and melatonin low, no chance of sleeping. So your brain is the guiding mechanism that allows you to sleep or not. And as a father, if you want to do your kid a favor, cuddling with your child is fantastic. But cuddling with blue light, mobile devices, and bright torches is not going to work. It's going to set your brain up so that that little brain is not ready to go to sleep. You will get excited. The melatonin will be suppressed very much so in children. And from there on, you will have what our members have asked us. My child can't go to sleep even if I put him or her into bed. So first of all, remove your energy savers from your bedroom, from your bathrooms, from those areas, definitely. Possibly even from the lounge in the evening. If you want to work on a mobile or digital device, make sure you install energy or light-saving, light-changing softwares that remove the blue light from the screens. You have them on your phone, you have them on your PC, you have them on your tablets. Otherwise, you use special glasses. They look like orangey. They remove the blue light and let you read and do your thing on a digital device without getting the blue light. By the way, we're talking about kids here, but it's not just kids, it's you as well. Adults have the same issues. You are no different than your children. So make sure when the sun goes down that your light in the house also settles down. Eat supper early. You do not want it closer than 2 hours to sleeping time. So in other words, if kids are supposed to go to sleep at 8 o'clock in the evening, make sure they get their supper around about 6 o'clock, 6:30 latest. Establish a cuddly hygiene. What does that look like? As a father, if you're working somewhere and you come home in the evening and you love your children, take them away from mom. Mom's often had a day full. She's had more interaction with the kids generally than the father. Take your kids, put them in the bath, make fun, blow bubbles, do whatever kids do in a bath. Be there, chat to them, engage with them. Cuddle them, chase them, wrap them in blankets, have some fun. Then you pull them out and you dry them and you cream them and you do what one does with little kids. From there, after supper, go and cuddle down in bed, you read them a story or think up a story and tell them a story. If you read something, use a darkish, sort of moderate light. Don't use a bright light. Try and read calming stories, not horrible, exciting, scary stories. Some kids are very sensitive to that, and that's not a good way to settle them down. And you know the story. When you read a book, they've heard it 3-4 times. In fact, if you read something different, although they can't read, they'll correct you. They'll tell you what you have to read. Anyway, that's a valuable package for a dad. Cuddling, bonding, reading books, settling them down for an amazing good night's sleep. The last thing I want to emphasize, bedrooms are rooms to recover and rest. You do not want to have mobile devices. You do not want to have Wi-Fi routers. You do not want to have charging mobile phones next to their pillow, under their pillow. Please, please, please do not do that. It disrupts their frequencies, it disrupts their sleep, and it doesn't do them any good. The debate is still on as to how much it charges and changes them. We are not sure what the damage is, but what is sure is that it's not good for them. So try and remove it if you can. And I'm sure your sleeping times and your going to bed times will run a lot more smoothly than they used to be before. Thanks for listening. If you want to know more, join our platform, Puzzle of Health, that's been built to improve family health and breach or talk about these topics and teach proper home health care and family lifestyle. Thank you. Have an amazing day.